Good evening. My name is Roberto Alvaro Ruiz, and I'm a PGY3 general surgery resident at Mayo Clinic, Rochester. I'm happy to be presenting our work contrasting short-term outcomes between laparoscopic, hand-assisted, and open hepatectomy. The boundaries and extent of liver resection continue to expand with improvements in surgical approach, operative technique, increased utilization of minimally invasive surgery, and postoperative management. The selection of an MIS approach is largely predicated upon surgeon preference. However, decision-making could certainly take into consideration the indication for surgery, the size of the lesion, the anatomic location, and the planned extent of the resection, as well as the size and location of the extraction site, as well as background liver pathology. Controversy exists as to the equivalency of a hand-assisted approach with respect to pure laparoscopic surgery, and whether or not a hand-assisted approach confers any benefit over an open hepatectomy. Given the relative lack of data guiding this decision-making and choice of MIS approach, it was the purpose of this study to examine the short-term clinical outcomes of all three surgical approaches to help guide such decision-making. We conducted a retrospective review of consecutive cases of hepatic resection for any indication at our high-volume institution over a 17-month period. We divided the groups into pure laparoscopic, hand-assisted, and open, and liver resection alone was performed. Any operation where additional procedures were performed concurrently were excluded from the analysis. To take into consideration the influence of patient selection, the operative approaches were also stratified by the extent of liver resection, and then a multivariate analysis was performed to account for clinicopathologic and operative variables. Our cohort consisted of 424 patients, including 298 open resections, 107 laparoscopic resections, and 19 hand-assisted resections. There was no statistical difference appreciated between the groups or for the laparoscopic versus hand-assisted cohorts for any patient characteristic. The mean age of patients in the cohort was 57.6 years old with a slight male predilection and a mean BMI of 28.6. The indication for hepatic resection was malignant pathology in about 86.6% of cases. Patients undergoing an open liver resection were more likely to have an underlying malignant pathology at 89.6%. And while the R0 rate was decreased in the open group, this did include a substantial amount of patients that had neuroendocrine liver metastases, where an R1 margin is often the objective. We further stratified by type of hepatectomy according to the Brisbane terminology of anatomy. Patients that were selected for an open approach were more likely to undergo a complex resection, including hemihepatectomy, in close to 40% of cases. Those in the MIS cohort experienced higher rates of segmentectomy and sectionectomy, particularly left lateral sectionectomy, and there was no difference in the type of hepatectomy between the laparoscopic and hand-assisted groups. We then compared short-term safety outcomes, including major morbidity and mortality, operative time, and patient length of stay. While total morbidity as well as minor and major morbidity were increased in the open group, there was no statistical difference in major morbidity between the laparoscopic and hand-assisted cohorts. The 90-day mortality rate was 1.4%, and notably, there were no mortalities experienced in 90 days in either of the minimally invasive groups. With respect to operative time, the mean operating time for the laparoscopic group was 4.8 hours, while in the hand-assisted group, it was 5 hours. This difference was not statistically different. Operative time was comparatively increased in the open cohort. In terms of estimated blood loss, the mean blood loss between each minimally invasive cohort was not significantly different at 303 and 454 milliliters of blood loss, respectively. The blood loss was comparatively higher in the open cohort at 658. In our analysis, pure laparoscopic approach represented the superior technique with respect to inpatient length of stay when compared to hand-assisted, with the pure laparoscopic approach resulting in a mean length of stay of 4.3 days compared to 6.2 days in the hand-assisted group. Multivariate regression strengthened that association on inpatient length of stay. On univariate regression, the hand-assisted and open cohorts were statistically identical with respect to baseline patient characteristics. Segmentectomy was performed at a higher rate in the hand-assisted cohort, and there was decreased morbidity on univariate analysis. When accounting for age, sex, BMI, indication, type of hepatectomy, and post-op morbidity, both the rate of postoperative morbidity and inpatient length of stay were similar between the cohorts. However, when specifically analyzing the subsegmentectomy, segmentectomy, and sectionectomy, the length of stay was decreased, suggesting that as the magnitude of hepatic resection is reduced, the benefit of the less invasive approach is established. Now, this study did have several limitations. Notably, it was a single center retrospective review, although this did result in application of homogeneous postoperative patient care pathways. The study also included only highly experienced or high volume liver surgeons, thus negating the influence of a learning curve, making its generalizability to less experienced centers unknown. The study also collected patients over a short time period and suffers from a limited sample size, although statistical significance was able to be reached in the reduction of length of stay between both minimally invasive cohorts. So in conclusion, MIS liver resection performed purely laparoscopic or in a hand-assisted fashion, both can produce equivalent patient safety outcomes. They have similar operative metrics and incur similar morbidity. With respect to pure laparoscopic, it is associated with a significant reduction in inpatient length of stay when compared to the hand-assisted cohort. And then in our data set, hand-assisted represents an intermediate approach in which benefit over open resection is conferred when considering lesser hepatic resections. Thank you for your time and happy to take any questions.